How would my cancer journey be different without the Prostate Cancer Support Centre? I really don't like to think of that, quite frankly. I think it would have been a nightmare. Well, when I first received my diagnosis, you're nervous and scared, and you can't remember half of what's being said. My surgeon, he took me straight through to meet Minita and introduced me to the cancer support program. It was like being given a warm blanket, because all of a sudden we had somebody and a program that was there designed to look after you. You realize you weren't on your own.
When I first got diagnosed, I was really shocked, because at my age of 60, the doctor considered me on all other aspects. I was a quite relatively healthy adult, and I do a lot of exercise, running, jogging. When the urologist confirmed, he gave me a booklet. The booklet itself contained information of the Prostate Cancer Supportive Center. So when we look for information, we went on the website to see what other programs that I can take advantage of.
The Prostate Cancer Supportive Care Program offers education and treatment in various areas that patients may be having problems at the time of diagnosis and onwards. The program has 8 modules. The first module is for men who are recently diagnosed with early-stage prostate cancer and who usually not made a decision about what type of treatment they'd like to have. And our Module 1 explains those options with the physicians who actually do the treatments. The second module deals with sexual health. It has an educational component, but it also has a clinical component. The third module is exercise. The nutrition module is next, and this is something that we are asked about by patients and especially partners who want to help keep their spouse or partner healthy. The next module is about urinary incontinence or loss of urine after surgery. The next module is about androgen deprivation therapy or hormone therapy, which is a common treatment for men with either early stage or late stage prostate cancer. The next module is counseling. And the final module is for men with metastatic disease or disease that's spread to other parts of the body, and talks to them about the different treatments available here in Canada.
The 2 programs that I selected on the physical exercise as well as the physiologist in helping my healing on my incontinence situations. When I go see them one-on-one, they put me in a very comfort zone by understanding my mental state. They could design a program that tailored to my current state and give me exercise instruction and using some equipment, particularly the biofeedback, is very helpful, which is a machine that measures my pelvic floor muscle, and it showed me that what is happening, that part or that muscle or that body part will be healing, but it will take time.
One of the most rewarding things about working with someone like William is to witness firsthand how working on our treatment targets, our exercises, improving his awareness of his pelvic floor muscles, all translated into improvements in his quality of life. Seeing him and his spouse come in and report improvements in their ability to spend time together and his ability to feel well again and feel more confident in his new body, that was one of the most rewarding things about working with him.
All of the programs have been very, very helpful at different times. The lifestyle aspect of it all is very important with food, exercise. The program has definitely provided me support other than medical care. The mental support with the one-on-one sessions has been exceedingly important to me. I was extremely nervous when the whole program started. You know, you don't know where you're going, you didn't have control. What the program does is it gives you information which gives you a feeling of control.
The biggest benefit of the program is taking a time when you're really anxious and helping you to reduce that anxiety by providing like multifaceted care, like care in every dimension of your life.
If the prostate cancer supportive care program didn't exist, I think a lot of patients would be kind of floating around out there trying to understand what their problems are, trying to self-diagnose, and perhaps not really getting the answers and the help that they need. I think what excites me is that we're continuing to move on and develop our services, expand them to patients in sort of underrepresented populations. And I think it's very important for people to understand that this program is not funded by the Ministry of Health. The majority of our operating funds come from philanthropic donations. So raising more money through donations will, number one, help us continue doing what we have been doing, will allow us to treat more patients and help men with prostate cancer attain better quality of life.
I cannot imagine that without the prostate cancer supportive care program. If I just stay on my own, I actually could be still in a hopeless or lost state. By talking to a professional, I'm gaining my confidence. I'm in a very comfortable environment, and I kind of gaining back my strength. And I guess most importantly, I have confidence that one day I will be fully recovered.
The prostate cancer supportive care program has provided me with a roadmap going forward, because quite frankly, without the support and care that I've received so far, I wouldn't be alive. I have to be extremely thankful for that and make the most of life.